Top 25 BSc Nursing Exam Interview Questions and Answers. Preparing for a BSc Nursing Exam interview is an essential step toward launching a successful career in healthcare. Interviews assess not only your academic knowledge, but also your clinical judgment, communication skills, compassion, and ability to work under pressure. Employers look for candidates who can provide safe patient care while demonstrating professionalism and teamwork. This guide is designed to help nursing candidates build confidence by understanding commonly asked questions and how to answer them effectively. By reviewing these practical and professional responses, you can present yourself as a competent, caring, and well-prepared future nurse ready to serve patients and healthcare teams. 1. Tell us about yourself. I am a dedicated nursing graduate with strong academic training and clinical exposure in patient care. During my BSc nursing program, I gained hands-on experience in medical surgical wards, community health settings, and emergency care. I developed skills in patient assessment, medication administration, infection control, and teamwork. I am compassionate, detail-oriented, and committed to providing safe and ethical care. I also value communication and patient education, ensuring individuals understand their treatment and recovery plans. I am eager to join a professional healthcare environment where I can apply my knowledge, continue learning, and contribute to improving patient outcomes through quality nursing care. 2. Why did you choose nursing as a career? I chose nursing because it combines science, compassion, and service to humanity. I have always been motivated to help people during vulnerable moments in their lives. Nursing allows me to make a meaningful difference by providing care, comfort, and education to patients and families. During my studies, I discovered the importance of holistic care, including physical, emotional, and psychological support. The profession also offers continuous learning and growth opportunities. I am inspired by the responsibility nurses carry in patient recovery and safety. This career aligns with my values of empathy, dedication, and commitment to improving health outcomes. 3. What are the main responsibilities of a nurse? A nurse's primary responsibilities include providing safe and effective patient care, monitoring vital signs, administering medications, and assisting in diagnostic procedures. Nurses assess patient conditions, document medical information accurately, and report changes to physicians. They also educate patients and families about treatment plans, medications, and preventive care. Maintaining hygiene, infection control, and patient comfort are essential duties. Nurses advocate for patient safety and emotional well-being while ensuring ethical and professional standards are followed. Additionally, teamwork and communication with healthcare professionals are crucial to delivering coordinated care and improving recovery outcomes. 4. How do you handle stressful situations in a hospital? I handle stressful situations by staying calm, prioritizing tasks, and focusing on patient safety. In high-pressure environments, I rely on my training and follow established clinical protocols to make sound decisions. I break tasks into manageable steps and seek support from senior staff when necessary. Effective communication with team members helps reduce confusion and ensures coordinated care. I also practice emotional control to maintain professionalism and reassure patients. After stressful situations, I reflect on my performance to learn and improve. Maintaining resilience and a positive mindset helps me perform effectively even in demanding healthcare settings. 5. How do you ensure patient safety? Patient safety is my top priority. I follow proper protocols, such as verifying patient identity before administering medications or treatments. I adhere to infection control practices, including hand hygiene and use of personal protective equipment. Monitoring vital signs and recognizing early warning signs helps prevent complications. Accurate documentation and clear communication with healthcare teams reduce medical errors. I also educate patients about safety precautions, such as fall prevention and medication compliance. By remaining vigilant, attentive, and organized, I ensure a safe environment that promotes recovery and prevents avoidable risks. 6. What would you do if a patient refuses treatment? If a patient refuses treatment, I would first remain calm and respectful of their autonomy. I I would try to understand their concerns by listening carefully and addressing fears or misconceptions. I would provide clear, simple information about the benefits and risks of refusing treatment. If needed, I would involve family members and the healthcare team to support decision-making. Documentation of the refusal is essential to maintain legal and ethical standards. Ultimately, I respect the patient's rights while ensuring they are fully informed and supported in making decisions about their health. 7. Explain infection control practices in nursing. Infection control is vital to prevent the spread of disease in healthcare settings. Key practices include proper hand hygiene before and after patient contact, using personal protective equipment such as gloves and masks, and maintaining sterile techniques during procedures. Proper disposal of biomedical waste and safe handling of sharps reduce contamination risks. Cleaning and disinfecting equipment and patient areas are essential. Isolation precautions must be followed for contagious conditions. Educating patients and visitors about hygiene practices also supports infection control. Consistent adherence to these measures protects patients, staff, and the community. 8. How do you prioritize patient care? I prioritize patient care by assessing urgency, severity, and immediate risks. Patients with life-threatening conditions, breathing difficulties, or unstable vital signs receive immediate attention. I use clinical judgment and triage principles to determine care priorities. Time-sensitive treatments, medication schedules, and physician orders are followed carefully. I also consider patient comfort and emotional needs while managing multiple responsibilities. Effective time management and communication with team members help ensure all patients receive appropriate care. Prioritization allows me to maintain safety, efficiency, and quality nursing care even in busy hospital environments. 9. What is the role of communication in nursing? Communication is essential in nursing for ensuring safe and effective patient care. Clear communication helps understand patient concerns, symptoms, and needs. It also allows nurses to educate patients about treatments, medications, and preventive care. Accurate reporting to doctors and team members prevents errors and improves care coordination. Compassionate communication builds trust and reduces patient anxiety. Active listening and empathy enhance patient satisfaction and cooperation. Documentation is also a critical form of communication that ensures continuity of care. Strong communication skills promote teamwork, patient safety, and improved healthcare outcomes. 10. Describe a time you worked in a team. During my clinical training, I worked with a healthcare team to manage patients in a busy medical ward. We coordinated responsibilities such as monitoring vital signs, administering medications, and assisting with procedures. I collaborated with fellow nursing students and senior nurses to ensure timely patient care. Clear communication helped prevent errors and ensured smooth workflow. When a patient's condition worsened, we quickly informed the doctor and provided immediate care. This experience taught me the importance of teamwork, cooperation, and mutual respect in delivering safe and effective healthcare services. 11. How do you handle difficult patients? I handle difficult patients with patience, empathy, and professionalism. I listen carefully to their concerns and acknowledge their feelings without becoming defensive. Understanding their frustration or fear helps me respond appropriately. I maintain a calm tone and provide clear explanations about their care. If conflicts persist, I seek support from senior staff while ensuring patient dignity is maintained. Respectful communication and emotional control often help de-escalate tense situations. My goal is to build trust and ensure patients feel heard, respected, and cared for. 12. What are vital signs and why are they important? Vital signs include body temperature, pulse rate, respiration rate, and blood pressure. They provide essential information about a patient's physiological status. Monitoring vital signs helps detect early signs of illness, deterioration, or recovery progress. Abnormal readings can indicate infections, cardiovascular problems, respiratory distress, or shock. Regular monitoring enables timely medical intervention and prevents complications. Accurate recording and reporting ensure effective treatment decisions. Vital signs serve as a baseline for assessing patient health and evaluating responses to treatment. 13. What would you do in a medical emergency? In a medical emergency, I would remain calm and act quickly following emergency protocols. I would assess the patient's airway, breathing, and circulation while calling for immediate assistance, initiating basic life support if necessary, and ensuring oxygen supply are critical steps. I would prepare emergency equipment and assist physicians during interventions. Continuous monitoring and documentation are essential. Clear communication with the team ensures coordinated action. My focus would be on stabilizing the patient and preventing further complications. 14. How do you maintain patient confidentiality? I maintain patient confidentiality by protecting personal and medical information at all times. I only share patient details with authorized healthcare professionals involved in care. Medical records are handled securely, and discussions about patients are conducted privately. I avoid sharing patient information in public areas or on social media. Following ethical guidelines and hospital policies ensures patient privacy. Maintaining confidentiality builds trust and upholds professional integrity in nursing practice. 15. What is patient-centered care? Patient-centered care focuses on respecting patient preferences, needs, and values while involving them in decision-making. It includes providing emotional support, clear communication, and individualized treatment plans. Nurses ensure patients understand their conditions and care options. This approach promotes dignity, comfort, and trust. Patient-centered care improves satisfaction, adherence to treatment, and overall health outcomes. 16. How do you administer medication safely? Safe medication administration requires strict adherence to established protocols to prevent errors and protect patient health. I follow the 5 rights: right patient, right medication, right dose, right route, and right time before administering any drug. I verify physician orders, check expiry dates, and confirm patient allergies. Proper hand hygiene and aseptic technique are essential during preparation and administration. After giving medication, I monitor the patient for side effects or adverse reactions and document the administration accurately. I also educate patients about the medication's purpose and possible side effects to promote compliance and safety. 17. What are the qualities of a good nurse? A good nurse demonstrates compassion, patience, and a strong commitment to patient well-being. Clinical competence and attention to detail are essential for safe and accurate care. Effective communication skills help build trust with patients and ensure clear coordination with healthcare teams. Emotional resilience allows nurses to handle stressful and sensitive situations professionally. Integrity and ethical practice are vital to maintaining patient dignity and confidentiality. Adaptability and critical thinking enable nurses to respond quickly to changing patient conditions. A dedication to lifelong learning ensures continuous improvement and the ability to provide evidence-based, high-quality care. 18. How do you deal with patient pain management? Effective pain management begins with accurate assessment using standardized pain scales and careful observation of patient behavior. I listen to the patient's description of pain, including location, intensity, and duration. Based on physician orders, I administer prescribed analgesics and monitor their effectiveness. Non-pharmacological methods, such as repositioning, relaxation techniques, cold or warm compresses, and emotional support can also help relieve discomfort. I reassess pain regularly and document responses to treatment. Educating patients about pain control methods encourages cooperation and reduces anxiety. Proper pain management improves comfort, promotes healing, and enhances overall patient satisfaction. 19. Explain the importance of documentation in nursing. Documentation is a critical component of nursing practice because it ensures continuity, safety, and quality of care. Accurate records include patient assessments, treatments, medications, and responses to interventions. This information helps healthcare providers make informed decisions and track patient progress. Proper documentation also serves as legal evidence of care provided and protects healthcare professionals from liability. Timely and clear charting reduces the risk of medical errors and miscommunication. Additionally, it supports quality improvement and audits within healthcare facilities. Maintaining precise documentation demonstrates professionalism, accountability, and commitment to patient safety. 20. How do you educate patients about healthcare? Patient education is essential for promoting recovery, preventing complications, and encouraging healthy lifestyles. I explain medical conditions, treatment plans, and medications using simple, clear language appropriate to the patient's understanding level. I encourage questions to ensure comprehension and address concerns. Demonstrations and written instructions can reinforce learning, especially for medication use or wound care. I also educate patients about preventive measures such as hygiene, nutrition, and follow-up care. Involving family members can enhance support at home. Effective patient education empowers individuals to take responsibility for their health and improves treatment adherence. 21. What is triage in nursing? Triage is the process of prioritizing patients based on the severity of their condition to ensure timely and appropriate care. It is commonly used in emergency departments and disaster situations where many patients require immediate attention. Patients with life-threatening conditions such as breathing difficulties, severe bleeding, or cardiac distress are treated first. Nurses assess vital signs, symptoms, and urgency to categorize patients accurately. Effective triage improves patient survival rates and ensures efficient use of medical resources. Strong clinical judgment, quick decision-making, and calmness under pressure are essential skills for performing triage safely. 22. How do you prevent patient falls? Preventing patient falls is essential for maintaining safety and avoiding complications. I begin by assessing each patient's fall risk based on age, mobility, medications, and medical condition. Safety measures include keeping beds in low positions, ensuring adequate lighting, and removing obstacles from walkways. I encourage patients to use call bells for assistance and provide mobility support when needed. Non-slip footwear and bed rails may be used when appropriate. Regular monitoring and patient education about fall risks help reinforce safety. These preventive actions reduce injuries and promote a secure, healing environment. 23. What is the importance of hand hygiene? Hand hygiene is one of the most effective measures for preventing infection transmission in healthcare settings. Proper hand washing with soap and water or using alcohol-based sanitizers removes harmful microorganisms. Nurses must clean their hands before and after patient contact, after handling bodily fluids, and after touching contaminated surfaces. Maintaining hand hygiene protects patients, healthcare workers, and visitors from infections. It is especially critical when caring for immunocompromised individuals. Consistent adherence to hand hygiene protocols reduces hospital-acquired infections and promotes a safe clinical environment. 24. How do you handle workload pressure? Handling workload pressure requires strong organizational and time management skills. I prioritize tasks based on urgency and patient needs to ensure critical care is delivered promptly. Staying calm and focused helps maintain accuracy and efficiency even during busy shifts. I collaborate with team members and delegate tasks appropriately when necessary. Taking brief moments to regroup helps maintain mental clarity. Maintaining a positive attitude and professional composure ensures patient care quality is not compromised. By staying organized and communicating effectively, I can manage workload demands while providing safe and compassionate care. 25. Where do you see yourself in 5 years? In 5 years, I see myself as a skilled and experienced nurse contributing to high-quality patient care in a reputable healthcare facility. I aim to strengthen my clinical expertise, particularly in specialized areas such as critical care or community health nursing. I plan to pursue advanced certifications and continuing education to enhance my professional competence. Additionally, I hope to mentor junior nurses and support teamwork within the healthcare environment. My long-term goal is to grow into a leadership role while maintaining compassionate, patient-centered care and contributing to improved healthcare outcomes. Preparing thoroughly for your BSc Nursing interview can significantly improve your confidence and performance. Employers seek nurses who combine clinical knowledge with compassion, communication skills, and professionalism. By practicing these common questions and understanding the reasoning behind strong answers, you can present yourself as a competent and dedicated healthcare professional. Remember to remain calm, honest, and patient-focused during your interview. Confidence comes from preparation, and preparation builds success. With determination and a commitment to excellence, you can begin a rewarding nursing career dedicated to improving lives and supporting healthcare communities.